Hello, I'm Dr. Rick Miller, and I'm with Dr. Raegan Vaughan and Dr. Stan Crawford, and we are fresh off our annual planning meeting, and we first started in 1998, so this would be our 21st meeting. And a lot of the meeting was looking at 2018 and really most importantly looking at our move to our new facility, which we're really excited about. People have seen as they've been driving by the new building and all the action going on with it. And we are due to be in the new building probably sometime April. We're not exactly sure yet, but I want to visit with these guys and get their input on why we did the building and what's the benefit going to be for our patients and all that kind of stuff. So, Dr. Stan, tell us a little bit about why we were building a building.
Well, I think we'd stretched the limits of our old facility, and really it was a matter of access for our patients. We wanted our patients to have great access, and we have really thought that out in the way it's designed. The parking, no steps to get in, easy handicap access, and so it's going to be much nicer for our patients and much more comfortable. We even did a big awning that comes out over the parking lot, so if it's inclement weather, you can be dropped off and not be rained on, so that's a good thing. The other thing was we were just out of space, and growth has been a good thing for our business, and it's just we got to the point where we added Dr. Raegan about 1.5 years ago, and his practice has grown, and so our office space is maxed out, so it's been time.
Dr. Raegan, part of it is your fault. You came and we came out of room, but no, seriously, it's been great to have Dr. Raegan, and what are some of the things that you're excited about in the new building?
Well, like Dr. Stan said, we're in the current building, we're just kind of running out of space, administrative space, office space, and one of the things I'm really excited about is really just having a place where I can go sit down and work on some of, my treatment plans, and that will give me the opportunity to, provide better care for the patients that are coming in the door.
So we are excited. We have a room that we've dedicated to a conference table and computers, and to be able to do treatment planning that we all can sit around the table and look at x-rays and pictures of our patients and really do comprehensive treatment planning for our patients. So that is going to be nice. Yeah. So, Dr. Stan, what about as patients enter the office, what are some of the things they're going to be able to see too?
Well, I think they'll find the aesthetics much nicer and enhanced, and the waiting area is going to be exceptional. We're really looking forward to seeing how that turns out, and Dr. Audrey and a couple of the girls have really been working hard on making that a beautiful, comfortable, peaceful area, and then it'll have a separate children's area. So your kids will be able to come in and have an area where they've got stations to keep them occupied while waiting. And then another thing I'm really excited about is we have some surgical suites that'll be quiet for our sedation area, and so when we sedate patients, we'll be able to cut down on the noise level. Before, the volume could be pretty high, and if you were trying to be sedated, it might be distracting. So now we're able to keep that area quiet and peaceful, and I think it'll be much nicer for our patients.
Dr. Raegan, one of the other things that we're excited about is just having a little extra space to be able to see emergency patients. And can you kind of comment on that?
Yeah, so right now I've been working at one operatory, to whereas Stan and Rick have a couple operatories going, and I'm looking forward to the chance to expand my schedule as I gain new patients, and that just the added facilities are gonna really allow me to grow as a doctor and as a dentist there.
And one final thing, the one question we were all excited about, space and technology and all that, and the one question everybody always asks, are you going to have a fish pond and can we feed the fish? You guys allude to that.
Well, absolutely. We're going to have landscape by Dr. Leonard Miller, and he's the one that designed our existing garden area, and he will be, his great input will be involved in the new garden area, and we will have fish ponds and koi fish, and so bring your kids to feed the fish. We'll still be able to do that, and it'll be just a beautiful setting when it's all finished.
Sounds good. Well, we're excited. Thanks, guys, for answering a few of those questions, and we'll try to keep you updated in the future.